I think that a practice called mindfulness helps with all types of rage. And mindfulness is not something you want to learn when you're full of rage. You want to learn mindfulness when you're in a position where you can actually practice it in peace and master it, right? So you want to think about how you can sit still in a moment and be present and be able to then pick and choose what thoughts you want to put on a pedestal, what emotions you want to put on a pedestal, and which ones you want to shelve, right? And that amount of agency to be able to pick and choose your feelings and your thoughts, well, you need to practice that when you're not full of rage. So I suggest with my patients that, mornings tend to be best for a lot of people, that they pick a part of the morning to just sit still and be present. And it could be a very simple practice of sipping your coffee or sipping your water, right? I use water a lot to teach mindfulness in my sessions. And I'll, be like, okay, we're going to stay grounded in our moment. We're going to focus on the five senses. We're going to sip the water. It's and describe how it feels. It's cool. It's wet. We're going to listen to how the nails feel on the glass. We're going to look at the colors, look at the hot pink or, stay present in the moment. So as you're describing this very rudimentary, basic experience of drinking water, you are being present in the moment. And the more you do that, the more you practice that, you're able to, when you're hit with emotions, when you're hit with rage, you're able to kind of go into the Zen-like, my daughter likes Kung Fu Panda. I think about when he was able to master the dumplings, like you're like, whew, and you're able to master that rage. That when patients get to that point, they're just so grateful because that's something that you can keep with you for an entire lifetime. Your hormones may stop working, your
Right.
antidepressant may stop working, but that mindfulness practice, once you master it, you can continue to use that for the rest of your life. So I
Mhm.
think that's something that's very helpful, right? So when the husband comes in and he leaves the thing on the floor again, and it's like, well, you're going to go into your little state, you're going to
Right.
practice your mindfulness, and you're going to pick and choose how you want to react, what you want to do, whether or not you want to shelve this feeling for now or deal with it in the present, right? So I think mindfulness can be very helpful.
I can't help but think as well how helpful it may be in a professional setting. Because again, right, so many women are talking about this thing coming up, whether it's rage or just, I don't know, frustration that feels somehow out of control in a professional environment, being able to kind of like, I don't know, neurologically gear down and be present and focus on something that just shifts all of that. I imagine it's incredibly helpful. So thank you for that so much. Um,
I do think that the hormone, the buckets of rage I talked about,
mm,
rage due to anxiety, rigidness, rage due to mood, depression, rage due to ADHD, right? I think that with hormones, you get a little bit of both, right? Because when you have hormonal fluctuations in the menopausal mood period, you're having challenges with executive functioning. So that's the ADHD
right.
part. You're having challenges with your mood. That's the depression bucket. You're having
Yeah.
challenges with anxiety. So you're getting a little bit of each, right? How fun is that, right? So again, having the mindfulness as a tool can address each bucket, but it takes practice and it is doable and just about anyone can do it.